Number 8. Minimizing the threat of antimicrobial resistance and infections associated with antibiotic use.
The introduction of effective antibiotics in the 1940s ushered in an era of optimism, with rapid declines in deaths due to infections. Since that time, however, antibiotic resistance has emerged rapidly, and too few antibiotics are making it through the development pipeline. That means once curable infections could soon become more virulent and even untreatable. The decline in the usefulness of antibiotics is troubling on multiple fronts. But perhaps one of the most serious is the accompanying rise in infections with multi-drug resistant organisms, particularly in hospitals and other healthcare settings. The danger lies not just in the superbugs themselves, but also in another infection linked to antibiotic use, Clostridium difficile colitis, which causes life-threatening diarrhea, primarily in those recently treated with antibiotics. C. difficile represents the leading cause of healthcare-associated infection in the U.S. In 2011, nearly 500,000 Americans became infected with C. difficile, and roughly 30,000 patients died within a month of diagnosis. Researchers are now working to combat this formidable health threat by leveraging machine learning and other artificial intelligence approaches. For example, researchers in Massachusetts and Michigan are developing a tool that uses clinical data from patients' electronic health records to create an AI-based risk score that reflects a patient's likelihood of developing a C. difficile infection. The score incorporates diverse types of data, such as medications, procedures, healthcare settings, and staff, lab results, vital signs, and more. It can also help create daily estimates of C. difficile infection risk for each patient, predictions that can then be used to develop targeted interventions that help minimize the threat of this formidable superbug. These and other AI-based innovations are helping clinicians better tailor treatment according to the needs of individual patients. And that kind of precision is essential to preserving the long-term success of our precious antibiotic arsenal.
Representing this topic is Erica Shinoy. Erica, can these AI